name is Tom Tempest, and this is my story. Thank you for listening. I went in for a routine rotator cuff surgery a couple of years ago, and I knew that I would be off for 4 to 6 weeks, and I knew that it was going to be painful. But nothing could prepare me for what I experienced when I was led into that surgery. I ended up developing septic shoulder, and the pain that goes with that is excruciating. And I want to explain, the reason I'm telling this story is so that physicians can understand what happens to a patient when things go really wrong. And also the power of apology and the power of caring, which is, I've experienced both of those things. A lot of things happen when you're in extreme pain. Your body changes. You have no appetite, but if you're taking the pain medications, you need to take some sort of food. Your elimination system and your digestive system just take a wallop. This was completely changed me and my outlook. After the second surgery, I was taking a lot of OxyContin and oxycodone, and I was in a lot of pain, and eventually that started leveling off. Then I started to try and go to, get through that and sleep, and I almost couldn't sleep for 3 weeks coming off of those, and that was really horrible. That was physically a really tough time. Emotionally, I have some other times that were really tough. One of them was after the third surgery. After the second surgery, I went and found another doctor, not because my other doctor was bad, just because I felt that I couldn't go into that surgery suite again. And I had a lot of hope for this second doctor. He thought that he could take care of me and fix that rotator cuff. So on the third surgery, I went in quite optimistic, and when I came out, I looked at my wife and said, "How'd it go?" And she was trying not to cry and shook her head and said they had found more bacteria. At this point, I became very down. I started seeing a psychologist. I started taking antidepressives. I became hypersensitive about germs and things like that, and I was wondering if I would ever get through this. So then again, on the fourth surgery in May of a year, my second surgeon was ready to go in. I was clean of bacteria that appeared, and he went in and he said he threw the kitchen sink at my surgery. So he said that, the material in there was not very good because the muscles had atrophied, the tendons, and the infection had its way with that area. But he was hopeful, and so I was hopeful. We kept going to physical therapy, trying to get my muscles to fire, but that just wasn't working. So finally in October, we had an MRI done. I read the radiologist's report, and it said that all repairs had failed. Well, this was a pretty bad day. It was made worse when I went home and we decided we'd move. We had sold our house on the lake and moved into a rental because we didn't know what my job and this would all turn out to be. We then, that night that I got that news, moved to a trailer park with our trailer, and in the move we lost one of our cats. After that, my second doctor felt that all that was left to do was a reverse total shoulder replacement. And that my arm, I finally realized, would never be the same. Up to that point, I thought maybe I would be able to be the same, but with the reverse total shoulder replacement, at least I might get a little bit more motion out of it, and I'd relieve some of the pain. So he felt he needed to wait until a year from when I had been bacteria or infection-free, which had been the previous March. So then I just prepared myself and waited for March of 2013, to get a total shoulder replacement. So on March 19th, I went in, and I woke up again, and I looked at my wife, and she said they had found more bacteria. and the doctor had done an irrigation and debridement, and he planned on doing it in another day and a half, or on the 21st. He did another one on the 21st, irrigation and debridement, under full anesthesia. So I had 2 operations in 3 days. At this point, when I woke up, he looked at me, and I was talking to him, and I said, I don't want to wait another year to try and do this again, because we waited a year last time and it didn't make any difference. And he just kind of shrugged, and as if, you know, that was what he wanted to do. And I said, I think I'll get a consultation from another doctor. And he said, just let him know. So I met my 3rd physician, my 3rd surgeon, on April 10th. And I'll tell you about that meeting in a minute. But April 12th, after we had come home, my shoulder all blew up and turned purple, and we were scared. We went into the emergency room, and they said, something really bad's going in there. We may have to take you into surgery. And I looked at my wife. I said, not here. We're going to go to the 3rd doctor. So we drove the 4 hours at 4 o'clock in the morning to the other doctor. Got there in the emergency room. They greeted us. A guard took the car away. Mary Jo started taking care of the paperwork, and they put me on a gurney and took me into the operating room. It turns out I didn't have a septic shoulder, which I was scared to death of, but I had a blood clot the size of a grapefruit in my shoulder. I have to tell you that there's a lot of bumps between here and Seattle, and I felt every one of them during that ride. But I was glad it wasn't a septic shoulder. So I met my 3rd surgeon on April 10th, just before this happened. And I came to the receptionist, and she already knew my story. And she said, I'm very sorry for all you've been through. And she meant it. And then the assistant, taking our blood pressure, said the same thing. And then when the doctor came in, he said, you've had quite a time. What can we do for you? I can't explain the healing that took place then. That doctor intensely cared. Since that time, I've had another surgery where he cleaned out my shoulder, and then I've had my reverse shoulder replacement, which went perfectly. I needed his caring and the whole team's almost as much as I needed the operations. My life has been changed, and I will never again be able to lift more than 15 pounds with my arm. I'll never be able to climb a ladder or crawl, but at least my pain is less, and I have a little bit more emotion with it. I have other issues I'm dealing with just from the trauma of 2 years. It's important to be part of the healing and not just the fixing. All of the doctors that worked on me were good people. They had the credentials and the training to do what they did. But I don't think they intuitively knew how to care or how to respond to someone who's been through all of this. Excruciating pain. Try going for months without using your dominant hand. Try eating or brushing your teeth with your other hand. Try not smelling for 6 months because of the antibiotics and still only getting about half of it back. All these things change you, and 24-hour-a-day pain changes you too. But the caring I was given did everything. Of course, it took the surgery too to do whatever could be done with my shoulder. Please, when you're working with someone and something goes wrong, understand that the patient really needs to hear that you really care. Honestly apologize for what they're going through, whether it's your fault or not. I'm not going to say this was anybody's fault. Infection happens. But it really made a difference when I found that physician that would do that. Thank you very much.